My name's Holly and I'm one of the medical nurse injectors here at Romsey Medical Practice. I am a registered nurse and I qualified back in 2008. So around about 14 years as a registered nurse. Started my career in the NHS. So when I qualified as a nurse, I joined Southampton University Hospital and I worked in the NHS for around 12 and a half years. And very proud to say that I've worked in cancer care for all of that time. And so in cancer care services, working in different areas of oncology, haematology, and largely looking after the teenage and young adults with all types of cancer. So alongside that time in the NHS, I sort of probably quite a few years ago now, started to kind of develop a bit of a sort of curiosity and interest in medical aesthetics. And back then, it wasn't really the industry that it is today. You know, there wasn't a huge amount about it. So I took quite a while researching courses that I could go on, and eventually found a course that I felt was, you know, suited to me, and I felt comfortable as a medical professional going on that course. So finally bit the bullet, booked the course, and then of course life happens, and I've since had two beautiful children. So I've got a lovely 3- and 5-year-old. I knew about Emily and Chris. I was following them through social media. A hairdresser actually mentioned them as well. Kind of following them before meeting them, you know, I liked what they were about. They reflected kind of my values as a medical professional as well. A few years ago that I contacted Emily and Chris just to see if there was any opportunities coming up to join the team. Was lucky enough to join the team just over a year ago now. Luckily for me, sort of starting with the guys, you know, amazing mentorship from both of them. But not only that, I know most of our patients will know Chris is very passionate about teaching and education. So I've had lots of, you know, additional training through Chris. So kind of done all my foundation treatments again. So fillers, dermal fillers, anti-wrinkle treatments, skin boosters like Profilo. What I love about the new practice is it's purpose-built for what we do. It's a nice clinical environment for our patients to come into. You know, it makes patients feel very safe. It's really nice actually to have, you know, a separate area now for our patients to come into. So a nice warm reception area for them to kind of relax in before waiting for their appointments. You know, we've got some lovely treatment areas, nice and spacious for our patients to have their treatments. And it's also very nice to have a staff room now as well. Hopefully here still at Romsey Medical Practice, but I'm just hoping to develop my skills a lot more, so doing some more advanced treatments. And again, that's what kind of attracted me to working with Emily and Chris. I wanted to, you know, be part of a team so we can very much kind of bounce ideas off of each other, and it's really nice to kind of have, you know, colleagues that you can discuss things with, you know, treatments and learn things from each other. I'm looking forward to kind of developing my skills and hopefully in the near future I'm doing my nurse prescribing course. I just feel it's going to give me a lot more independence seeing first-time patients.